people are just bringing in. So I think we'll make a start. If a few people come in now, then that's absolutely fine. So welcome. So this is the first care home webinar that we've done in respect of COVID-19 infection control. My name's Louise Tarpley. You probably recognise me from a number of visits that I may have done, or at least we'll have spoken on the phone or emailed. And if I just hand over to Hannah for her to introduce herself.
Thank you. I'm Hannah. I'm the training lead for the direct services in Northamptonshire County Council. So I support all of the care homes within Northamptonshire County Council with their training. So I've been working closely with Louise around training and things like that.
Okay, so everybody should have received an agenda, and we are going to try and follow that agenda as much as possible. However, I would just like to reiterate, this is your meeting, so please feel free if you've got any queries, you know, to ask. And you can ask questions by either writing it in the chat, and we will try to keep up with the chat and respond to those questions, or raise your hands and we'll then unmute you and you can speak. But we would like as many people to participate as possible. Hopefully you can see the presentation, and so you can follow, because we have shared that screen. Just to confirm to everybody, the session is being recorded because lots of people weren't able to attend this week and would like to see what has been discussed. Your microphone is on mute. As I've just said, if you have a question, would like to contribute, please write into the chat or raise your hand. The information discussed and shared in this webinar is in line with current government guidance at the time of recording. And as always, please always refer to current government guidance in addition to watching this webinar. And what I would say is that Hannah and I have, you know, we are as up to date as we can be. However, we don't always have the answers to all of the questions. If we can't answer, we will make sure we take down your query and get back to you. So hopefully, is everybody ready to start? Yeah, Hannah, are you okay?
Yeah, all good here.
Good. Just making sure everybody can hear me, as we had a little bit of technology issues on Friday when we were practicing. So, COVID-19 fatigue. I'm sure that all of us are rather fed up now of COVID, of coronavirus. It's been a long 6 months and there doesn't seem to be an end to it. I'm sure when all of this started, we all felt it was going to be a couple of months. You know, we closed our care homes, we stopped visitors, we suddenly started wearing PPE. It was all very strange, but we thought there'd be an end. And I think one of the difficult things at the moment is there doesn't seem to be an end. We don't know when it's going to be, and we know that we will have to continue living and working as we are doing for the foreseeable future. But, you know, we still have to adhere to the guidance around PPE. It is still important. We are now, you're now undertaking regular testing. And I think it's paramount to say that we have had positive staff. We're all doing our day-to-day living and maybe exposing ourselves to more risks than we were maybe doing a few months ago. We're also regularly testing. You know, many of us that get tested and that are positive are asymptomatic. But what we can say is the regular resident testing is showing that the wearing of PPE is working. We've not got lots of cross transmission to our residents, and that really is, you know, thank you to all of you that continue to wear your PPE in adherence to the guidance. I put the photograph, hopefully you can all see that. I'm sure that you walk around the shops, etc., and see mask use in lots of ways. But what I would say is it is still really important that within our care homes, within our residential homes, when we're working with clients and when we're with staff in those environments, that we continue to wear our PPE correctly. And you know, I can't insist enough that your mask is single use. Once you take it off, it gets disposed of and you put it on again, and that it is sessional. And I know, because you know, I wear them as well, wearing a mask for a long time, it does take it out on you, but it is so important that we do wear it correctly. We've had a couple of queries around, you know, when you're eating and drinking. What we'd say is it is still really important that when eating and drinking, you remove your mask, you dispose of it, you eat, you drink after washing your hands, you then replace your mask. So it does mean a different way of working. It does mean that maybe when you're in training, you have to go out and have your breaks. When you're working, you can't have drinks within the clinical area. You know, you go to your staff break areas and have your drinks. Another query that we had was around coughing and sneezing. You know, we still sometimes have a cough. Some of you, I know your asthma has probably affected you more because of the mask wear, and that's increasing the coughing. We're having the general sneezes. You will probably cough and sneeze into your mask. What we advise is that a bit of coughing, it's not a problem, but if your mask feels dirty, feels like you've coughed on it, sneezed on it, wash your hands, remove and dispose of your mask correctly, and wash your hands, put a new one on. And it really is correct, you know, really important to continue with that correct donning and doffing of all your PPE, still continuing to do it in the right order, making sure that your gloves and your apron are single use, that if you do have to wear a visor because you have symptomatic residents, that you wear that correctly. And as I say, you know, please be reassured that what you're doing is right. It is correct to wear the PPE, and as I've said, it does help to prevent your residents, your family and yourselves. So testing, I know again this is it just feels like it's never ending, doesn't it? And I think, you know, a lot of staff have done really well to undertake the testing on their residents. Staff continue to test themselves. I know a lot of the issues is around putting the boxes together, uploading it onto the computer. So, you know, you've all done an absolutely great job. And we do recognise that it's not a perfect system. I think Hannah and I would both say we are as frustrated with some of the issues that there are around the testing. And we know that there continues to be delays, and, you know, we are escalating through the correct routes when there are delays, and escalating our issues. And it isn't just a Northampton issue, it is across the country. That doesn't make it right. And we do know that, you know, staff will get tested, they get tested positive, there's worry about them working those couple of days that they've worked, and we do understand that. However, you know, the government, the test and trace are working on getting those tests back to you as quickly as possible. And you all know that you need to escalate your issues through 118. Unfortunately, we can't resolve those locally. Isolating, I think again, I've done quite a number of visits, and I think all of you have really worked to understand how you can isolate and how you can shield your residents if need be. It's easier in some homes than it is others. We will go through zoning shortly. That's one of the next presentations. But just a reminder, as somebody did ask the other day around, you know, if you have got somebody who is symptomatic and you haven't got and the sort of enough staff just to have staff isolated to that person, then it is okay to share the staff. And what we're advising is, if you cannot have one-to-one staff, that you do your asymptomatic residents first, then any symptomatic, and then any positive. And if you do that, that helps to reduce any risks to your residents and to your staff. But as I say, we'll go through a little bit about zoning later. And then staffing. Hannah is going to go through a little bit more about the well-being of staff, and also some of your concerns that have been escalated through from many of you. And what I would say is we do recognise that staff, again, are feeling tired, and I think it is just about reiterating how well they have done, and how to continue to support our staff in this difficult time. But I know that Hannah is going to do a little bit more work on that. So is there any questions before, oh gosh, sorry, I've just gone and, sorry.
We have got a couple of questions, Louise. Shall I read them
yeah,
out from the...
That'd be great, yes.
So we've got Sarah Jane who's asked, she says the guidance suggests not retesting a positive result. However, we really believed that one positive we had was a false positive because everyone else who was tested was negative. We did retest and it returned negative. Should there not be any exceptions on the 90 days?
No, so it is really difficult because I think lots of people have felt that they've had a sort of a false positive. I don't have the answers to how the positives come about and why it suddenly then becomes negative. We don't know whether somebody may have been positive a lot longer, and because we've not tested for 28 days that may be the reason. However, the guidance is very clear now not to retest anybody that's been positive for 90 days. So locally, Public Health are not advising any exception to that. And even if the person has tested negative following a positive result, we still need to treat as a positive. They still need to be isolated for 10 days. All in accordance with guidance. So I know it's frustrating, but we do need to follow that guidance.
Okay, there is a further question kind of carrying on from that to say that if that's the case, why the hospital retesting?
So we have escalated to the hospitals that they shouldn't be retesting, and we have advised Public Health that there have been concerns about them retesting. And what we do is, from my point of view, if I have identified anybody that has retested a positive and that's caused us issues in the care home, it does get escalated through the appropriate governance route. So my understanding is that the hospital shouldn't be retesting, that it is very much if they've got that positive test, that it's not retested for 90 days. But I will take that up, because if you are still getting issues around hospitals retesting, then I'll escalate that up to Public Health so we can follow it through.
Okay, a couple more things have come through, just while you've been answering that one. Is there any movement on antibody testing for residents? From Catherine?
No, not that I'm aware of. There's obviously more and more work being done around the antibody testing. I think for me, the antibody testing, even if there is evidence that you've had the antibody or you've got the antibody and therefore potentially you've had it, we still can't be sure that you won't catch COVID again. So we still have to work in accordance with guidance. So I think although it can give us some assurances, it's not a complete response to it. So, you know, but again, as soon as we do get any information around antibody testing, I will let you know.
Mm-hmm. A question to say that Public Health have informed them that isolation for residents is 14 days and 10 days for staff following a positive test. Why is there a difference?
I don't know, actually. I wasn't aware. I mean, locally, the advice is 14 days because we just feel that within a care home environment, because there's more of a risk of cross-infection and residents aren't wearing their PPE, then we advise 2 weeks for a resident. However, the official guidance is if you have a positive test, whether you're resident, staff or general public, the official guidance is 10 days.
Okay. And then the last one that we've got at the moment, if you've been told to isolate by the NHS app, but your test was negative, it's just disappeared. Your test was negative, should you continue to isolate?
So if you've been asked, it depends why you've been asked to isolate. And I think this is why each issue often we have to look at individually, because if you've been asked to isolate because you have been in contact with somebody, that's very different than somebody thinking that they may be positive or having thought they'd be positive, because we know the incubation period is 2 weeks, and that's why if you've been in contact, you have to have a 2-week incubation. Obviously, that's not the same when you're working in the care home environment, because you're wearing PPE, and that is your assurances, and it's why we don't, through test and trace, we don't ask every care home staff member who's been in contact with another staff member to isolate unless there's specific issues. So I don't think there's a caveat answer for that. I think we have to look at each individual case. So if you were asked to isolate and then you got something saying that you weren't positive or there was queries, we'd need to look at it and look at it in line with the guidance.
Okay, great. There is something else in there for us to raise, but we can do that after the session. It's just something to raise with regards to hospital discharge.
Yeah.
Okay.
Yeah. Okay, so I'm going to, so if there's no more questions on that, I'm going to escalate up, hand you over to Hannah for the next session.
Thank you, Louise. Would you be able to pop the slide on to the challenges slide for me, please?
Okay.
Great, thank you. So we asked for some feedback, well, we've been receiving feedback from you and communications with you guys through myself or Louise, obviously over the last 6 months, that there's some patterns that have come up in some of the challenges that you faced within the home. So we wanted to just address some of those and share with you some of the best practice that's been happening within the homes, just to make sure that you're all able to kind of make the most of that. One of the main ones that gets raised and has briefly been covered already by Louise is about the PPE and wearing masks continually. So that's kind of a shared challenge across all of our services. So we're just wanting to reinforce the need for regular breaks and making sure that people are really understanding the use of their masks, as Louisa said about the putting on and taking off routines, and making sure that everyone's really familiar with those and that they're not pulling them to the side. But if they do want to stop for a break and go and have something to eat or drink, that they're actually removing it, disposing of it appropriately, and putting a clean one on when they go back into any area where they're with residents or staff. So it is just about keeping on reinforcing that. We don't want people to get into bad habits because this is becoming a bit of the new normal for us, wearing face masks. So it's just about reinforcing the need for them all of the time, and making sure that people are able to take regular breaks, because we all know, we've all been wearing them too, it is extremely uncomfortable to wear one for such a long period of time. So we need to make sure that we schedule those breaks in and give staff the opportunity just to take it off to get a drink or whatever it is that they want to do on their break. Another challenge that you guys have found with wearing the masks has been the impacts that it has on communication. When we've asked for some feedback around that, I've had some really positive things that have been happening, which is great. So we know that it can impact, because obviously we use our facial expression when we're communicating. So we need to continue to do that when we're wearing our mask, and know that a lot of that will be seen through the eyes and also through any gestures or body language. So all of your unspoken communication is really important when you're wearing your mask, to make sure that you're using that. Making sure that people are talking clearly, using clear language, and louder but not shouting, obviously, but louder communication if needed, along with all of those other bits. Removing any background noise if you can, so communicating in a more quiet environment so there's no distractions or background noise. And a lot of you have shared with us different communication aids that you've been using. So you've used things like written communication instead of spoken, where the challenges are there. So hopefully some of you can take some ideas away from that. If you have got any more that you've been using, please pop them into the chat there, and we'll scan over those at the end of this little section. If you've kind of found any good ways of overcoming those challenges, I'm sure everyone would really appreciate hearing those. Working in a person-centred way. So some of you, certainly right at the start of the pandemic, some of you spoke to us about the challenge of keeping things person-centred. When, for example, you've got to isolate someone, or you can't do your normal practice that you would with them, their normal daily routine, for example. which makes that a really understandable challenge. So again, if you've got any ideas at all what you've done to maintain that, please share it with us. Some of the things that have been shared with me when I asked for some feedback around this was one of the homes when they've had someone within isolation, when that's ended, they've arranged outdoor visits, obviously following guidance, wearing PPE, etc., with family, just to raise that person's spirits after the period of time where they have been in isolation, which is great, to give them that interaction with family then. Meaningful activities for people to do within their rooms, so things like puzzles, any sensory things, looking at photographs, listening to music, so making sure that that time when people are spending, especially if they're isolating for the 14-day period, that they're given those meaningful activities throughout their day, so that they're not just in their room on their own. One home told us about a socially distanced beach day that they did during the summertime, which was fantastic. They had sand, small bits of sand and water, so that they could still get that sensory thing. They had a barbecue and they decorated the home and outside, so that, you know, they had that seaside theme, which sounds really great. You know, a beach day in lockdown when we couldn't actually get to the beach is a nice way to lift spirits. And actually the feedback that we got around that was that it lifted everyone's spirits, staff and residents, because it's just as important for us to be thinking about our own well-being as well as the residents. So again, if you've got anything that you've done that could be good practice to share, please pop it into the chat. Maintaining standards. So some of you have told us that there's some challenges to maintaining the standards in relation to the COVID guidance. So things like hand washing and PPE, maintaining that standard, because people might be starting to get a little bit more relaxed with it now. A couple of you told us about regular competencies that you're carrying out with staff. So doing those checks, making sure that people are putting on and taking off their PPE correctly in line with the guidance, and that they are hand washing correctly, giving that feedback, and also encouraging them to do that for each other. So when they're working in a unit and they're observing their colleagues, giving feedback if things aren't being done in line with that guidance, because as Louise said with her little section on PPE at the start, it's so important that that guidance is followed correctly, and that people are putting on and taking off their PPE correctly now as much as it was right at the start. Some of you have said about refresher staff being beneficial for training, so we're hoping that the recording of the webinar is going to work. I said to Louise right at the start, it's the first time we've recorded a webinar on Zoom, so we're really hoping it does work, and we'll be able to send this out to you so that staff that haven't been able to attend will be able to access it. If it doesn't, then we will send out the slides with some extra information on them so that you can share it with your teams for the people that haven't been able to access today. So that can be used as a refresher. You know that you've always got the guidance that's online, and we're going to give you some links at the end of the presentation to online guidance that you can use. A lot of you are printing off posters and having those within staff areas of the building so that people are reminded of the guidance, changing those regularly so that they catch people's eye and remind them about, you know, how to take off PPE, when they should be wearing what pieces of PPE, when they should be hand washing and that type of thing. So maintaining standards will be a lot about refreshing people's knowledge. Skills for Care do set out guidance of how regularly our training should be refreshed, but we're really keen that you more frequently refresh your infection control and PPE training at the moment, just to keep that knowledge as up to date as it can be and at the forefront of people's minds. Okay, so that's that little section there of challenges. I don't know if anything's come up in the chat. Louise, have you noticed anything that we need to...
Just hold on a minute, I'm not exactly IT literate. I have to... Right, that's it, okay. So let's have a look. So Sarah Jane, we arranged to take a client for... Oh, that was about 48 hours. I think that's the last one. So yeah. Catherine has said, we at Oakcliffe have found certified clear face masks for staff and residents who rely on lip reading for effective communication. Happy to share the details with anyone that feels this may be useful for their service. Catherine, I'd say yes, please. If you could send either Hannah or I the link, and we'll circulate it with this recording to everybody. because I think that's a really, really good idea, and it's one of the things I know we found difficult with the face masks. So brilliant.
Thank you. Yeah, that'd be great.
Courtney, I'm not sure where you're from, but you said you did a Hollywood-themed musical in the garden for residents while social distancing, which they really enjoyed.
Brilliant.
Again, that sounds absolutely brilliant. And I know that I've been to a few of the care homes when I've been visiting, and seeing some of the virtual efforts that you've put on and the number of iPads now, and it is just absolutely brilliant. And some of the, some of fates that you've had online and such like, so absolutely great that people are doing that.
Brilliant.
And oh, Courtney, so you're from Margaret's Rest Home, that did the Hollywood themed musical, so that's absolutely brilliant. And Sarah Clark, we bought some simple LCD writing tablets to aid communication, £10 on Amazon. Oh, that's a really good idea as well. I think that just shows you're a bit more up to date with IT, because I think I was telling people to use, do you know the old, oh gosh, the things you'd scribble on and then you could get rid of them, but that sounds absolutely brilliant, the writing tablets. So yeah, absolutely brilliant idea.
Brilliant. We've got a message as well there. I think it's only come through to me from Anna at Obelisk. They've got a specific notice board around COVID, which they're updating regularly, and that's working really well for them. So that's another really good idea. Have that where staff know, the place to go to get the most up-to-date information.
Brilliant. Had one here. Isolation, very difficult with new admissions who are unable to retain information. One-to-one needed mostly, sometimes not always possible. Staffing ratio. I think absolutely, and I'm not sure if anybody's got any easy responses to that, because especially if you've just been admitted from hospital or maybe from home and it's your first time in a care home and you have to spend 2 weeks on your own in your room, that is difficult. And I know a lot of the homes have really paid attention. We've put in photos in the rooms, doing the one-to-one nurse care, which I know is not always possible. And so I think, if there are anybody else that's got some advice for some people that are having to isolate their residents for 2 weeks, then let us know. Sarah Jane, we've ordered a pod which has different entrance for residents with a glass partition which has a microphone on either side for communication. Oh, fabulous. So this is to support visiting then when we won't be able to do garden visits because of the because obviously of the weather. And I must admit, I saw something the other day, I can't remember if it was just put up on Facebook, but a care home had again put in screens so that people can visit and the wiping down in between. And I think it is about, this is long term. This is not closing your home for a couple of weeks. This is long term. How do you work differently to support visiting in a care home while this virus is going on? So absolutely excellent. I'm sure if you don't mind sharing, Sarah Jane, other people would like to see where you got that pod from. Yeah, Sarah, exactly how they work, like a digital Etch-a-Sketch. That's what I was trying to think of. So brilliant. Courtney, a COVID-19 activity care plan, which is brilliant. It is about still maintaining activities and still supporting our residents and ensuring their well-being isn't impacted. Is it a hard and fast rule that new referrals to a service must spend the first 2 weeks self-isolating? I can see this being a real barrier to settling in. Slightly off topic, so apologies. No, I don't think it is off topic, because I think from a wellbeing point of view for staff and residents, that 2 weeks isolation is difficult. However, the risk is that we all know that the virus has a 2-week incubation period. We also know that even testing negative on arrival doesn't mean that you're negative, the next day. It's just a here and now. And it is something that, in accordance with the guidance, I wouldn't support you going against that guidance. I think what you have to do is support the resident that is settling in to see how you can manage it. But I really wouldn't support going off that guidance for the 2 weeks, because what you don't want to do is have somebody that then starts merging with others and causing an outbreak. So is there any other questions for Hannah around wellbeing? Anything about staff wellbeing? I think, you know, we do
on the next slide anyway, Louise. If we go on to that, then people can add as we go, can't they?
Yeah, absolutely. Daryl's just put, not sure 2 weeks isolation is possible for patients with dementia and are able to walk. Again, we understand that it's really difficult, but what you have to do is manage it as much as you can. You've got your risk assessments in place, but the guidance is anybody admitted to a care home, it is 2 weeks. And I wouldn't support going away from that. I think it's looking at how you can manage it. I know some homes have been able to sort of block off a room with part of the corridor and maybe another seating area. That's not possible for all homes, so at least the person has been able to walk about even if they're on their own. Okay, shall we go to the next slide for everybody? Yeah.
Yep.
So, right, okay. Oh, yeah, sorry, Hannah, that's your next slide. Now I'll hand that over to you.
Okay, so we wanted just to put a little bit in around emotional resilience and kind of tying that in with well-being, and actually some of the conversations that you've just been having on the chat, the answers that you've given there to some of the questions have given some answers already to some of what we've got here, but we'll just go through some of these points. So you spoke to us a bit, or you have spoken to us a bit around responding to and supporting residents and their families. So a lot of what you've just said about enabling those visits, it's great to hear that you're thinking about how you're going to move forward with that. Now you can do garden visits as easily. It's fantastic. Just thinking about the fact that it isn't always just the resident that we're supporting. We have got their families to consider as well, making sure that they really understand the guidance within the home. So some of you have told us about the fact that you send out communications to families if something changes. So if there's differing guidance, or you've changed the way that you're managing visits, so part of your risk assessment has changed, making sure that you communicate with families, but also just making sure that you communicate with residents in a way that suits them so that they can understand what the restrictions are. We understand not all of your residents will be able to take on and retain all of that information, but it's about adapting it to suit them as best that you can. So that both the family and resident really understand, because we know that you have had some challenges with families finding it really difficult, which again we totally understand. If you put yourself in their shoes and your family member is living within that residential home and there's some barriers to you being able to visit them, it must be a really difficult time for them as well as the resident. So it is about understanding that and making sure that we're really clear with them what that guidance is and why we're putting it in place, you know, that it is from public health and the government advice. It's not what we believe is correct, it is what we have to follow, and that it's there to protect their family member, our residents, us as staff, and them as individuals visiting the home as well. We don't want to put them at risk as much as we don't want to put anyone else within the home at risk. So lots of reassurance and reinforcing the guidance, not assuming that everyone will be aware of it. Use your person-centered working that you've spoken about, all those things that you're doing for people, and risk assess personal situations. So there is guidance for visits to care homes, but we know that some of you have had specific situations with residents that have differed, and you've got in touch with Louise, I know has given some support and guidance around specific situations for residents. So if you have got that and you're risk assessing and you need some support, you've got the guidance there that you can access as well. Signposting, so making sure that you're aware of resources that staff, us, and residents and their families can access. And that could be around understanding the guidance relating to COVID, but it could also be about seeking any additional support that they might need, helping them to manage their mental health and mental well-being. There's loads of resources through NHS and online charities, Mind. There's on their websites all of the time they're advertising extra support around well-being and mental health, specifically relating to this challenging time. So make sure that people are aware of those resources and signpost to them if you think it would help people. Using debriefs, loads of you have fed back to me about debriefs that you're using. I've heard different services using different scenarios. Some of you already have kind of debrief procedures that you use that you've just adapted to meet COVID guidance. But it's really just about making sure that people have the support that they need in place, and the opportunity to debrief if they've had a difficult time, something particularly emotional or challenging. It could be with a resident, it could be with a family member or relative of a resident. So for example, we had a situation where a staff member had a challenging situation where family were not happy with the guidance that was put in place, and that's, you know, a difficult thing for us to deal with as staff members. So then just making sure that as a team you've got that debrief in place, that you can make sure that that person is feeling okay after dealing with that challenging situation. Loss of residents, hopefully you have end-of-life procedures in place anyway, but making sure that each member of staff is aware of those and that they're being managed well within the services. And staff wellbeing. So we've spoken about responding to the residents and their families and making sure that their wellbeing is maintained through that person-centred approach that you've been using. But also we've got to think about us and our colleagues that we're working with. So there's some things that you've shared with us and also some things that we've found online from Skills for Care and some of their webinars that they've done, and just some other resources as well. So some of you have told us about trying to keep the working environment a happy place to be. So staff are spending a lot of time at work, and in that environment during this challenging time, we want to make sure that that's as enjoyable as possible. So making that a nice place to be for the people that are working there. Recognising staff, their hard work and commitment. Sometimes that might just be, you know, thank you for your hard work today and your shift. I know that some of the staff that I've worked with who are frontline workers have said what a difference it makes to their day when they get that thank you at the end of their shift. So I'm sure you're all doing that all of the time, but keep doing that, keep recognising them, praising them and thanking them, because it really does make a difference to people. Ensuring people have the right training in PPE, so use of PPE, disposal, removing and putting it on, and infection control. And we've really found that that helps to reduce staff's anxiety around COVID and the risk to them. So really understanding that helps them to be able to understand, you know, exactly what they need to do to keep themselves and everyone safe, which in turn helps to reduce those anxieties that people have. People will have those anxieties and worries, and it's about respecting that and offering the reassurance that people need. So as a management team, making sure that you've got that support in place where people can come and discuss those concerns or worries with you, and that you'll be able to support them. Having individual conversations with people to offer reassurance and allow them to raise concerns. So as well as having that kind of open door policy that I'm sure you have as management teams, making sure that you're still giving people that opportunity on a one-to-one basis to talk about how they're doing, and if there's anything as a team you guys can do to support them further. Bringing humour into the workplace. You know, even without a pandemic, the challenges sometimes in residential care are difficult, and sometimes our carers are working extremely hard even in normal circumstances. And it's nice for them to be able to kind of have that bit of humour and a nice relaxed environment when they're at work. And those of you that did feedback said how important that is at the moment, not just that relaxed, but that, you know, people being able to have a laugh and a joke as well. Regular communication from management. So frontline staff have said it's helpful when they're getting regular communication from you guys, so make sure that you're maintaining that whenever there's an update, that you're sharing it and putting it into a format that really works for your carers on the front line. Handing out a huge piece of information, pages and pages, documents, sometimes isn't the best way to get across to frontline workers, and you'll know your carers best, and it's just about adapting the method that you use to suit them. And then there's other specific training like end of life, making sure that people have got training in that area and know how to support residents and support themselves as well, should that arise. Regular wellbeing checks with people, so literally just checking in to make sure that people are okay, and also looking after your own wellbeing. So as a manager, don't forget about yourselves. You need to be well to be able to support other people to be well. So all of what we've discussed applies not only to your team members, but to you guys as well. And that's it around wellbeing that we've got. But I think there's been a couple of things shared in the chat there. So
okay,
to
just bear with me 1 minute, I'll close that down. I'd also say around psychological support as well, the CCG do offer some support. Darren McGregor, who I think is actually on the webinar, if you have got concerns, you do want extra support, the CCG will offer it. Either contact Darren or feel free to contact me and I'll put you in touch with Darren. And what I would say, it is really important to look after yourselves as the management team, as the senior team, because I think sometimes we get so busy looking after our staff, we forget about ourselves, and this has been tough. I know some of you have slept in the homes, have spent, left your own home and moved in, and all of that takes its toll. So please do look after yourselves as well. Okay, so we've had from Courtney, we have put an extra phone line in place for residents' family to ring whatever time of the day, and also offering regular FaceTime on all the girls' phones with residents. I think it's amazing actually how we've adapted to IT. It's been absolutely brilliant. I'm sure, well, sort of 8 months ago, if we said we'd be doing all of this IT in a care home, we'd have laughed, but people have really taken to it. Is there any other messages around? Have you got some there, Hannah, from what you've just discussed? I can't see any more questions.
So yep. We've got someone, Anna, has said that they've noticed the staff are getting tired, especially the ones who have tested positive for COVID in the last few months. So, staff that are working throughout COVID, which is understandable regardless of whether you've tested positive. And it is about making sure that we support people to manage their leave appropriately, and that people are taking breaks when they need to during their shift, but also, either side of their shift. As Louise said, we've expected a lot of people, and people have had to work perhaps more than they normally would. So as a management team, just making sure that you monitor that and support people to manage their leave so that they're getting the breaks that they need.
What I would also say, I think it's been quite, it's been highlighted, it hasn't it, in the media about COVID fatigue for those people that have had COVID, and that has to be recognised, that they may not be 100% well. And I suppose it's supporting staff through their GPs, through your occupational health as well, to make sure they're fit for work and offering that support. So I don't think any of us at the beginning knew what COVID would mean. If you caught it, there's some people it hasn't affected, others it has, and I just think we need to recognise that. Definitely. Have you got some other queries there, Hannah?
Yeah, also from Anna, they've brought in cakes and sweets for staff just as a thank you. They're doing that regularly over the last few months. And those little things really do make a difference, don't they? They brighten up people's day, so that's great, keep that up. And then we have got another one there. So COVID has put a huge strain on the palliative care services and the GP services, surgeries. The need for advanced care planning and no hospital admission, symptom management for positive and end of life is very difficult for residential care, which has had a big strain on the emotional well-being of staff, watching people that they cared for deteriorate and being unable to do anything to help, or wait for hours for help to arrive. So that's around the need for medical intervention, I guess, and that not being as easy to access as it used to be.
So what I would say is the GPs are still there. You have still, if people need support, they need support. I think there has been an awful lot of bad publicity around people not, being given their care they need. And I hope that hasn't been the experience across Northamptonshire. What I would say is if you feel that you're not getting the support from the GPs, and the GP, it may be different support. It may be that it'll be AMPs, it may be more virtual. You still do need the support from your GP. There should be a named clinician for each care home. If you don't know who that is, then we'll support you in trying to find out. We will escalate to our primary care colleagues if you don't feel you're getting support. And when we have done the IPC reviews, and some of you have escalated concerns, please be assured we have escalated those to primary care colleagues to discuss with GPs and to try and ensure that you are receiving the services you need. I think for me, it is about having a good end-of-life care plan for your residents that need it, because we all know that if some of them are nearing their end of life, the best place for them to be is with people that they've known for a long time, and that is you. But it doesn't mean that it's not easy for you to care for people. And again, I think this is really important around when we talk about talking this through with colleagues, with your peers. It's also, what the team here are for is nobody's got an easy answer about how you cope with these, but you do need to think about your emotional well-being. And if you have had a bad experience, then you might need some support. And as I say, I think the psychological support that Darren McGregor's team has to offer is there, and I can't hesitate in saying, if you need that support, please don't be frightened of asking for it. This has been a tough time for all of us, and I know it's difficult as well because we can't go on holiday to the places we wanted to go on holiday to, but believe me, just taking a week out sometimes really helps. So make sure you have your breaks as well.
Yeah, and also Peers for Care have got a couple of resources that are helpful in relation to both the things that you've just mentioned. So they have got a webinar on dealing with the impact of COVID on your staff. So as a manager, the impact of COVID on your staff, which is a nice one to watch to get some ideas from. And they've also got some end of life stuff in relation to COVID as well. So if you have got people that are supporting at end of life and that's not something that they normally did as part of their role before COVID, there is training available for them through the webinars there, as well as other online resources like Dying Matters. So do make the most of those and make sure that they're shared with staff, because as you say, it's not an easy thing to deal with.
Sarah Jane has just put, Louise, you've been very supportive of both me and our home, signposting where necessary, and this has been really appreciated, and just want to say thank you. Well, thank you for mentioning that. That's very nice to hear. Tasker House, despite good end-of-life care planning in place, difficulties to access these services when required is what is very frustrating and emotionally draining. I just wonder, I agree, and I wonder if you'd like to contact me afterwards. I'm sorry, I'm going to call you Tasker House because I've not got your first name there. Perhaps we can talk through what issues you've had so that we can identify somebody in the CCG that might be able to support you and see if there's particular issues to your home or general issues across the services, because COVID isn't going away, and we need to make sure that end-of-life care planning is supported, and that if you need help, it comes in a timely manner. So whoever that is, if you could email me and I'll get in touch with you tomorrow and we can discuss that through and maybe find out a few more examples, that would be really, if that's okay. Jane from Rathgart, the support that Darren is offering, can this please be communicated to home so we'll have knowledge of this? So I'll speak to Darren. I'm aware that I know that where there has been concerns, Darren's been made aware. So yeah, I'll liaise with Darren to get that highlighted to everybody. Darren's just responded here. Sorry, was on a call. Happy to forward wellbeing information. So that's brilliant. We'll get that emailed out to everybody so that you've all got that information and you can all access if required. Thank you, Darren. And sorry, I've just missed Courtney. Could we have both, please, for the resources to have a read, as some staff might want to have to take a look? Yeah, so we will. We'll get that circulated. Okay. Any more questions or suggestions on staff wellbeing? It's not as if we can all go for a staff drink anymore either, is it? Because we're not allowed to, and I think it is about finding different ways of relaxing and just taking a breather from what seems to be constantly being on that treadmill. Okay, so happy for me to go to the next slide, everybody, yeah? Okay, let's have a look. So Okay, so the next thing I'm going to talk about is zoning and cohorting. Now, from the discussions that I've had with the majority of you, you are all doing this. You're all cohorting, but I think there had been some confusion because CQC had asked whether you'd received information around zoning. It really is just a different way for cohorting and just maybe identifying it as I've sort of said there, the red, amber and green. So I just wanted to update everybody and just reassure that what you may be doing is right, or if you haven't been able to cohort, just how we can take that forward. I think it's recognising different homes will implement differently due to the size, your number of residents, your environment. I mean, having 7 months ago, I'd probably been in 1 or 2 homes. I think I've now visited nearly all of the homes across Northamptonshire, and you know, the environments are so different. Doesn't make them wrong, doesn't make them right, they're different. And you can, you know, some of you will be able to have different corridors that will be able to zone off, and some of you are not able to do that, and you have to sort of zone according to staffing or maybe your community areas. So it is about looking at your care home, doing your risk assessment and zoning, you know, as best as you can. But there are broad approaches and models. So all care homes, you know, are applying safe practices. You know, even when there was no COVID-19 infections, we did implement infection prevention control measures. And it's, you know, that includes your smaller homes where it's not possible to create a physical separation. And practice arrangements will depend on your client group, example, dementia, learning disability and autism. And we've already had alluded to that sort of earlier when we sort of say, well, we've got to isolate for 2 weeks. How do we do that when when we have residents with dementia who are wanderers? And I think this is why I will say to you, there is no one right way for anything that we do. The guidance is there to support you, the government guidance. Hannah and I are very much trying to interpret that guidance to try and make it easier. But the bottom line is you have to undertake a risk assessment for anything you do. And I think sometimes it is about weighing up the risks. What is the bigger risk? And it's about ensuring that you are able to, if somebody asked you why you made that decision, you've got your documented evidence of why that decision was made. So there may be various changes and adaptations. You know, those might be within existing facilities to be able to cohort your residents. So you might have an area for people with confirmed COVID that is red. You might have an area that's amber for your residents with symptoms, and you might have green that's your asymptomatic residents. Now that might be that you have got, you know, different corridors with your different rooms, and you're able to geographically have those different areas. However, whether you may not be able to do that, then it's about, as we said earlier, you might be doing that with your staffing. So you might well say, well, okay, well, you are only going to be looking after the green residents today. You'll look after your amber ones and you'll look after the red. Or if you haven't the staffing to do that, we will do green first, then amber, and then red. And it's having that understanding what we mean about zoning. You may need to reduce occupancy. And I know, you know, that many of you, the occupancy has been reduced anyway because less people are being admitted maybe over the last few months. And you might need to think about how you use some of your rooms. And it's like we sort of said earlier, where we've tried, you know, with residents that have dementia, you know, you may not be able to stop them from wandering, but are you able to isolate all the people that might be red or that might be amber together so that there's not that risk of cross-infection? And within each area, we need to confirm clarity regarding numbers in each zone. The optimum numbers are sort of 6 to 10, but this will be dictated by what's feasible. I mean, some of you have quite large homes, so you might actually have your different levels, your different floors, corridors, and then you may zone in between those areas. Clarity regarding your target groups. For example, do they have to have had a previous negative test? Where will your new residents go? And each unit should be self-contained where possible. And what we mean by that is a different entrance, different corridor, dedicated kitchen areas, slews and bathrooms, PPE storage and equipment storage. Now, I know that not every home will be able to do that, and this is what I'm saying, it is where possible. And it's about implementing best practice where you can. It's also, you know, some of the older homes, especially those for learning disability, where they're very small homes, maybe have 5 residents. We know that they've not got their own facilities, so it's making sure you've got the procedures in for cleaning the facilities in between, you know, each time. Or if you do get a case, are you able to identify one particular bathroom area for the residents that are in the red zone? And PPE stations at each entry point with disposal areas and hand washing facilities. And I think that's really important, is making sure, because that prompts, and you know, all of you to put your masks on, to put your PPE on when you need it. I mean, I don't think any of us now enter our care homes without those masks, but the fact that they're in front of you, that is your prompt. It's your donning and doffing stations in each zone. And sorry, I've just probably gabbled on there. This is just reiterating what I've just said on the second slide. Another thing is about, you know, staff allocated to each unit where possible, and that does include your catering and domestic staff where possible. Especially domestic staff, you know, are you able to have a domestic that goes into just one area? Or if not, if you just have one domestic that's for the whole home, again, think about that red, amber, green. So you would do your green first, then your amber, and then your red. Catering staff, is there a need for the catering staff to enter the zones, or are they able to do whatever they need to do in the kitchen, and how do the meals then get to your zones? There isn't a simple answer for any of this. You know, this is all about doing your risk assessment, reviewing, and understand how your own home works. And what I would say is, if there's any concerns, if you've got any, you know, you're trying to sort out your zones and need some support with looking at the individual home, you know, please don't hesitate to contact me. We can talk it through, we can go through the risk assessment, we can see if we've got anybody that might be able to offer a risk assessment that they've already done in a similar home to yourself. Okay, so is there any questions around zoning?
There's nothing in the chat at the moment, so unless anyone's got anything that they would like to ask.
Okay, so the next part really was around, just bear with me, sorry, was around any just general questions. I know we've asked for questions as we've been going, but this is really the opportunity now for you to ask anything that you want to. It doesn't have to be about anything we've just been discussing. If there's anything that you think has been a really good example of what you've been doing in the home, if anybody wants to talk that through, we can unmute you, or please feel free to sort of stick it in the questions. If I just sort of take 5 minutes out just for people, or a couple of minutes out, just for people to have a think, because we've still got some time, so this is your opportunity while you've got Hannah and I to just really put it out there. And if you've got any queries that even if we can't answer, we can escalate up. It's all gone quiet now.
Mm-hmm.
One of the other things that if people could think about as well is how would they want the webinars in the future, and if they did, how they'd want them, what they'd like them to look like, and whether there's any particular subjects they'd like to discuss on a webinar for the future. I mean, if I'm not asking you to all sort of think now, but if somebody comes up with something, then again, email Hannah or I, because we will look at trying to put something like this on in the future as well. Okay, so Sarah Jane has sort of put, right, Daryl has put, something that worked okay for us was to have an IPC ideas board in the staff room to keep staff involved. Yeah, I think that's a really good idea, and I've seen that when I've gone around to some of the care homes, because you're right, just reading that, or the guidance that comes out, it's so difficult to get through. And I think if you can keep it easy, everybody knows what's going on. And also, if they're involved in, you know, well, that's the guidance, how do we implement it here? It keeps everybody involved. Sarah Jane Louise, I know we covered it, but the biggest issue for us is with regards to the communication with the mass. If there's an alternative, this would be most helpful. Seeing a smile is so very important for all, particularly those with dementia. Yeah, and I think somebody earlier did say they've got a link to ordering the mask. So one of the things you just need to make sure is those masks are fluid resistant, because don't forget the fluid resistancy will protect you as well as your residents, and it is important to keep your staff safe as well. I know it is, a smile is important. Believe me, even around behind the masks, people know what you're thinking, people know how you're feeling, and you do get your points across, you do communicate very well. I think there's a bit of a jokey thing going around at the moment, isn't there, about, because I don't know about you, but I do communicate very much with my face. Most people know, and I'm not very pleased because I don't seem to be able to hide it. And there's something about, now I'm wearing these masks, people think I'm approachable. But actually, it is amazing that even with this bit covered, your eyes are really expressive, your voice is expressive. I do understand as well the difference between trying to talk to somebody when you've got your mask on. You are shouting, because I know it's not as easy to talk quietly. And I think we just have to think of the different ways around it and recognise the issues. But we will look into the masks. And again, I know that I think the CCG may have had some. So I'll ask my colleague that has been reviewing some of the PPE, whether they've done any work with the see-through masks, and to see whether we can circulate a couple for people to try. So it's, again, that's on my to-do list.
Just had a message as well, again from Obelisk, a memory tree where customers and staff pinned messages to the tree, which was organised by their shift leaders, which was a bit of a breath of fresh air for them during the height of COVID. So that's really nice. Share a kind of somewhere where people can put those positive messages that can be shared with everyone, then that's a really lovely idea.
And there's one here from Catherine that says, we have completed a COVID experience survey for residents, staff and families to complete. This has so far been beneficial for data collection to show how the organisation has been responsive, but also prompted staff to have debriefs, residents to offer suggestions, and families to suggest improvements. This has collected positive data to be fed back to staff in the form of a report, how well staff have been praised by residents, to how they felt reassured by the staff looking after them, and how families felt, etc. This has been really positive for staff wellbeing. That's an absolute excellent idea.
That is really good, yeah.
Yeah, because I was saying initially, you sort of, whenever you say about it being a survey, you're like, oh, it's sort of a survey. But actually, how good sometimes to sort of just say, look, you know, in the most difficult 6 months of your career, look how well you've done. Because, you know, there really is no getting away. None of us would have expected to be nursing and caring in a pandemic. You know, where did this come from? So absolutely brilliant idea. And actually, Catherine, if you wouldn't mind, it'd be really good if that could be shared for maybe other people to take forward, if that would be okay. And then Obelisk House, we've noticed burnout. Sorry, I can't speak. We've noticed burnout characteristics. Our staff have been great, but now slowing down. We have open door policy. We have appreciation table, sweets, etc., encouraging regular breaks, encouraged to book annual leave, short breaks, and more often when available. Do you know, I think that is so true. I think when this all first happened, we all worked at 110%, didn't we? And I know, you know, from a personal experience, when I think about how many hours I put in when this first happened, I look and I think, gosh, I'm not sure I could do that again. And I think that's what's rather scary, as we know it's not going away, and as we know we're moving into a second wave. Because I certainly, and I'm sure none of you could do what you did at the very beginning constantly. You know, your adrenaline kicked in at the beginning. And I agree. I think we as managers, as staff, as people that look after each other, if we notice the burnout characteristics and the characteristics of staff, it's really trying to support our staff if we see those. And I think it's, as Hannah said, you know, we need to have breaks. We need to go for short breaks. We need to make sure we're taking our annual leave, and we need to make sure we're not doing over and above the hours, and recognising when we feel that we're burning out. So, no, I absolutely agree with that. And I think it's why as well that we need to, as we move to what we call sort of the second stage, or, you know, a second wave, we've sort of got to start working normally in this pandemic, because it isn't something that's sort of, right, well, it's going to last 3 months, and we're going to put all of it in 3 months and then we can slow down. We've got to think, you know, how is this going to work normally? How do we manage this by doing our normal day-to-day? And some things are going to have to be lost. You know, if there's work that needed doing before that's maybe not as important, do we stop doing that? So I think it's a really good point to make. Thank you. And then Tasker House, point on end of life visiting. We have palliative care residents who cannot get out of bed to have garden visits, or to be able to have video calling or window visiting that maybe in the last months, weeks of their lives. Would you as public health class this as essential end of life? Most families believe this should be. I just wondered what general opinion is. So I mean, what I would say is that the advice and guidance around visiting, you know, is the official guidance that is there. But this is about putting a risk assessment in place. And I know that there's quite a lot of care homes that have put a end of life risk assessments in place. And it's about supporting the person at end of life to maybe have visitors while keeping the rest of the home safe. And that's what you've got to balance. And, you know, it's about that person, that the visitors having PPE on, about not going into any of the other areas, about being accompanied by staff. So what I would say is treat every single case individually and look at it. You know, there isn't a broad no, it's about looking at each case, and if you can manage that, how do you manage it, and how do you manage it safely? But, you know, about following the guidance. And if you need support about completing risk assessments, I know lots of care homes out there, care home managers have completed those risk assessments. So, you know, shout out for those. We can share them if people don't mind sharing. Or if you do have a particular issue, then don't hesitate to contact Hannah and I, and we can talk it through. Daryl has said, does anybody operate a secret buddy scheme? Each person is allocated a secret buddy to do little things to lift spirits. I've never heard of that. I've heard of the Secret Santa, which I like because you always get a nice prezi. But no, has anybody else heard of that? Is there any?
I've not had that mentioned, but it sounds like a nice thing to do within your team. And
I think it is. I know that there is around, especially, and I think this happens in some of the bigger trusts. So I go on Twitter. A lot of my Twitter I do is sort of work orientated, and I see a lot of sort of colleagues from other trusts who have often received a mug or a pen or a badge or something which says like thank you. And I just wonder, you know, within the homes, whether that's something, you know, that you could do. And if some, you know, it is just about saying, you know, we recognise actually this week you went that little bit beyond, and even just certificates and things. So there is some really good ideas, which I think is a little bit similar to what Daryl's suggesting about the secret buddy scheme. Somebody gets left something on their desk to say, do you know what, thank you, you did a really good job this week. And I know a lot of the homes have their, you know, their stars of the week and things. So all of that really helps. And I think it gets forgotten when we're so busy and we're in this sort of pandemic situation, but it's more important than ever.
Yeah, and it's nice, I think, the of it being allocated within the team, so that it's not just left to you guys as managers as well to do that recognition bit, but that the colleagues do it for each other, is a really nice idea.
Yeah, I think Jane has just put up, you've been mugged, fill the cup with sweets without saying who it's from. Yeah, I like that. That's a really good
nice
idea. Yeah, and everybody's just sort of said. So, okay, any more from any more? Oh, brilliant. So Daryl has put about the new visitor guidance. So don't forget that guidance, use it to do your risk assessments. And again, each home will be different, because if you've got positive cases, you may need to change your visiting regulations. And you know, if you haven't, they might be a little bit easier. So, and you might be able to, if you've got a bigger home, you might be able to close some parts off and keep others open. So.
Debbie has raised her hand. Debbie, I've asked you to unmute. If you have got something you'd like to contribute, if you want to unmute your microphone, you're more than welcome to contribute. May have been an accidental hand raised. Okay. Do you want to pop the other, the next slide up, Louise, and I'll just talk through some of those.
Task has just put, thank you, Jane. I'm completing individual risk assessments, personalised plans, and those mean that family members agree with your opinion and the evidence. I just wondered what general opinions on the topic was. I'll pick that up, because I think you're right. One of the hardest things is when you have made a decision for the benefit of your home and then somebody disagrees with it. And I think there has been quite a lot of what I would call emotional blackmail around, you know, well, if my mum doesn't get to see their newborn great grandchild, then it will be your fault. I think the only thing you can do is you follow the guidance, you do your risk assessment, and you make your decision that is going to be safest for the whole of the home. And that, you know, and as long as you are able to stand by that and you've got that written, then I know I would support you as the person that's been doing the IPC. Public health would support you. There are always going to be the family that won't agree, and they are going to use that emotion. But at the end of the day, some of you are responsible for 100 residents, and you've got to keep all those 100 residents safe. I think there was a query around garden visits, and a lot of the, you know, families saying that they didn't want to wear the masks, and could they not wear their masks? The answer is you have to wear a mask. If you wish to visit, the mask is worn. This is to protect not only your family member, but actually all of the people that live here in this home. So absolutely, I think it is really, really difficult. And I would say, you know, if you've done your risk assessment, then you stick with it. If you need peer support or you need support from the CCG, then, you know, we can offer that for you, as in, you know, giving you that resilience and saying, you know, the rationale is this, it's following guidance. And I think, you know, we are always going to have family members that don't agree, but you have got to keep all of your residents safe. Okay, so if I pick up the, okay, so I think Hannah, that was just, did you want to go through?
Yeah, we will send out the slides, so these you'll just be able to click onto these to go to the links, but we just wanted to make sure that you were already aware of them, really. So the Safe Restart program is a series of webinars that are going to be starting over the next few weeks, and they're looking at things like virtual working, so ideas around how you can do what you would need to do but virtually, bits around staff wellness and positive risk taking and restrictive practice during COVID. So again, some ideas that you might be able to get from there to support you in your practice. Skills for Care, I've already mentioned, that'll be a link to their site. They have got the COVID page for managers, which has got loads of webinars on there to help you and staff. So again, use those to refresh people's knowledge, as well as in specific topics such as end of life. Public Health England guidance, which you'll all be familiar with, making sure that you check in on that regularly, because there are updates. If myself or Louise are made aware or notice them ourselves, we'll always send them out. We'll make sure that they're sent out to all care home managers. So we ask you to keep up to date with them, but obviously if we notice anything, we would always share it with you. And you've got the government site with all of the information around PPE as well. So you've got the posters and things that you can print to put up in your services, which it sounds like lots of you already do on your notice boards and things, which is great. If you have got any other resources that you've been using that you're happy to share, any other websites that you found really helpful, things like that, add them into the chat or send them over to myself or Louise so that we can share them when we send out the communication for this session.
Yeah, thank you. And one of the things I just also want to say, which I meant to say with all of the general questions, was something that had been escalated through around track and trace, contacting staff and advising to isolate. And just to confirm, if the contact is at work and it's confirmed the IPC adherence to PPE and social distancing where applicable, then the usual advice for care home and hospital settings that this is exempt from close contact and consequent isolation. So again, if you feel that you've been given some conflicting advice and you want to talk that through, then please don't hesitate just to sort of confirm. But often the track and trace, we'll look at it as a close contact if it was just a routine work environment. And I know there'd been a couple of conflicting advice that had been sent through. And then the other thing is, I'm sure most of you realise that this isn't my usual job, but I've been doing it for the last 7 months. But as we move to this is business as usual, the NHFT will be taking forward IPC support in care homes. Now, Denise Hunt, who was hoping to be on the webinar today, but unfortunately hasn't been able to, has been recruited as a nurse to that team and started, well, she restarted yesterday because she used to work for Ramsay Health Care and had been working with the team over the summer months. So she's back working with NHFT, so you may see Denise. Our environmental health officers have been supporting me to do the infection prevention control adherence reviews, because at the moment I went from working on my own to having quite a team to working on my own again. And so they've been supporting, but the long term is that NHFT will take this forward, and once they've recruited their manager, I will be handing over the service, and the service then about supporting care homes will be with NHFT, and they will help and support outbreaks and that long term infection prevention control support around COVID-19. So that will be business as usual. Okay.
So if there is anything that you guys think would be helpful from that team, it would be great if you could share that with myself and or Louise, so that when we start working with them, we can make sure that kind of moving forward, we've got the right steps in place. I know some of you have been part of like group WhatsApp chats and things like that for managers, and have found that really helpful. If there's anything else that they can do, regular webinars, you know, if that might be helpful for you, please do let us know so that we can let them know that that's what you guys are looking for as support. There's a couple of things just come up there before we do our thank you.
Okay.
Daryl has mentioned that the NHS tracker does not say where the contact has come from. So I'm not sure if that comment that was raised with you, Louise, may have been whether people need to notify people at work. So if you've tested positive, do you need to include your workplace? But as Louise said, if you've been wearing your PPE and maintaining social distancing.
I mean, I think one of the things that you have to do is look at the guidance around when and you should isolate. If you get contacted by Track and Trace to say that you've been in contact with somebody. And I think it's quite clear, if you look at the guidance, it's very much about that face-to-face contact. So if you know you've been somewhere and you haven't been wearing PPE because that's been in a, say, a social environment, then you are going to need to isolate. If you know that the reason you're being asked to isolate is because of the work contact and you know you've been wearing your PPE, then you shouldn't need to. But again, it's each individual, it's talking that through.
And Daryl's also commented to say anyone who has not applied for their free iPad from the NHS needs to do so by the 23rd. So you've only got a few days left for that. I think the regular communication that comes out from the CCG had that information of how to apply for that. But if anyone hasn't had that communication, give us a shout and we can forward that on. And then Sarah Jane is asking, when is the NHS team likely to take over?
So I'm not 100% sure. I spoke to NHFT today. They are being commissioned by Public Health Northamptonshire to undertake the role, not by the CCG. And I understand that they have been recruiting. It sounds like they have identified their lead manager, their lead nurse. That person has got to give notice. So as soon as they've got a start date, they'll let me know. And what I will do is all of the information I have, all of the reviews I've done, I'll hand over to them and for them to take forward. So it's probably going to be another 4 weeks at least, I would think, that I'll continue. But what I would say is my telephone number doesn't change. So, you know, and if you ring me and it's not me, I'll just redirect you, or, you know, so don't worry, we'll make sure it's as seamless as possible. Okay.
Yeah,
so
that's everything in the chat. So unless there's anything else anyone wants to add, I think we can wrap things up there.
Okay,
so we really wanted to end with a thank you to you guys as managers or team leaders, supervisors, and to your teams for their hard work and commitment during the COVID crisis. We're obviously aware that you always work really hard. We know that you always do a great job, but how you've continued to do that during the pandemic has been extremely inspiring, and it shows really just how amazing you guys and your teams are. So I think Louise mentioned it earlier in the session, hold on to that and make sure that people really feel appreciated, and recognise that for yourselves as well, because what you're doing is amazing, and continue to do that. As Louise said, if you need any support, make sure that you seek it. Hopefully what we've covered today has been helpful to help you to maintain that level of work that you're doing.
Yeah, and I would really echo that. I mean, this has been, I didn't think I'd be doing this in my current job, so it's been a hard 7 months personally for me. However, I have met some fantastic people over the last 7 months, and actually I'm going to miss it when I'm not doing it anymore. So thank you to everybody. And lovely, thank you. There's some thank yous there. That's great. So if there's nothing else, I think we've half an hour to spare, so that's really good.
Great, thank you everyone.
Thank you. Bye-bye.
Bye.